Hello, I'm Dr. Patrice Little here at NP Student Magazine, where we're keeping you updated with every aspect of your life in and out of school. Today, we are talking politics with certified registered nurse anesthetist, also known as CRNA, Sharon Pearce from Gardner, North Carolina. Welcome, Sharon. How are you?
Oh, I'm doing great. How about yourself, Patrice?
I'm so excited to have you here because right now in this season with pandemic and lots of changes in policy, everyone wants to know how can they go about becoming a nurse who advocates on a legislative level. So can you first start off by telling us about yourself?
Well, I am, as you said, a CRNA. I've been giving anesthesia for 30 years, which included my training. I have been a nurse for 36 years. Prior to going into anesthesia, I was an ICU nurse, which you have to be a CRNA, and then I worked in the operating room. So I've got a long history of leadership within organizations. I was president of the North Carolina Association of Nurse Anesthetists, fourth largest state in the nation for nurse anesthetists. And then I went on and served on our national board, and I was president of our national organization, the equivalent of the ANA, but it's the AANA, the American Association of Nurse Anesthetists, representing 57,000 nurse anesthetists in the country. And nurse anesthetists belong to their professional organization. Over 90% of all anesthetists belong to the AANA.
Wow.
Yes.
So that is impressive. Talk to us about how you're using those experiences now in policy.
Well, nurses typically are not involved in the policymaking process, and it is our goal to change that paradigm going forward. Nurses have always been the implementers of policies that everybody else makes for them. We want nurses to be the policy makers. Now, you can do that in several different ways, just by advocating, by being involved in politics. I hear people all the time say, I hate politics. I don't want anything to do with it. You're involved in politics every single day of your life. You are involved in politics in the hospital. You're involved in politics with your spouse, with your children, or lobbying, even going and lobbying, advocating per se. And people say, oh, I don't know how to lobby. Yes, you do. Don't you remember when you were 16 and you wanted the car? You lobbied to get the car on Friday night. So that's who we are. That's who nurses are. And there's no fear. You don't have to have fear whenever you are advocating. And our goal, like I said, is to push that progression forward from nurses just advocating to being the people who come up with the policies going forward. We want nurses to run for office. It's time for nurses to run for office. I mean, voters all the time will identify healthcare as one of their #1 voting concerns. And who are making decisions about healthcare? Shouldn't it be the 4 million nurses? Shouldn't it be the backbone of healthcare, the people who comprise the majority of healthcare? We as nurses should be the voices changing healthcare. Nurses know people's needs. We know the system, and we need to be the ones implementing, changing. Interestingly enough, there was a study that came out, and the public said that they trusted nurses more than any other group to change healthcare. Powerful stuff.
That's true. There is something called the nurse effect. And oftentimes, if you just walk into the grocery store and you have scrubs, it's so funny how the actual barriers drop in a sense where complete strangers will show you parts of their body, like, hey, I
Right.
have this here, it looks like you're a nurse, can you tell me what this is? They like, the trust is evident in that role. And I just think that we are well positioned to bring about change in how things are run at the hospitals, how things are run just in practice in general. At the end of the day, the fact that we have the most contact with our patients, it allows us to really have an appreciation of what their needs are. And that's where we're coming from when we continually say nurses definitely need to consider running for office, because they have a good appreciation of the needs. They understand the resources that are out there to address those needs. And yes, you are absolutely right. We definitely know how to lobby.
Yes, yes, we do. And you know, Patrice, you bring up a good point about the skills that nurses have. Whenever I will throw out there, Patrice, I think you need to run for office. There are a lot of different things that goes through people's heads, especially nurses. And then we'll talk about the gender piece of it here in just a second too, because since we're 90% female, there's a whole issue as far as gender and politics. But nurses are so well qualified. Think about what you do every single day. Being in politics is being a legislator. Let's say that. Let's say you are a state legislator. The skills that you would have are the same skills that you use being a nurse. It's the nursing process. Think about it. You assess, you plan, you implement, and you evaluate. That's the same thing that legislators do. Now, why would nurses make such excellent legislators, congressmen, or even on any board or any elected position? We're good listeners. Think about it. That's what you do every single day, all day. You're an excellent communicator. You're a translator. You're translating medical jargon, the medical process, everything down to how a patient can understand it. People even listen to me sometime whenever I'm talking to my patient, and you gear your speak to how they will understand it. I will be putting you to sleep today. Sounds a lot better to some people than I'll be providing your anesthesia today.
That sounds
So,
scary.
yeah, you know, so we tailor our speech to them. We're excellent collaborators. Every single day, you're collaborating with the nurse that you're working with, the physician you're working with, the pharmacist. I mean, a nurse truly is the hub of the healthcare wheel. You negotiate relentlessly. I worked with a young nurse yesterday. She's fairly new, and she was doing my pre-ops for me, and the patient had eaten. And so we were obviously not going to be able to provide anesthesia. And she said, you know, I think the patient still needs to have this procedure done, and it can be done without sedation. We can just talk her through it because she's in a lot of pain. So I told her, you advocated for your patient and you negotiated to get what that patient needed. So these are all skills nurses have. And you mentioned something a little earlier that I always say, nurses are eyewitnesses to patients' lives. You're there 24/7. Well, I hope you're not, but nurses are there 24/7, and you know who their family members are. You know the issues that they have. You know if they're homeless. You know who they live with. You know everybody. You are there the whole time, not just 2 or 3 minutes on rounds. So nurses are eyewitnesses, and that's why nurses are the perfect people to run for office and to change, because we know how to do it.
Agreed. One of the things that I love most about you is how you have taken this concern or this mission that you have to introduce this platform to nurses through your DNP project at Yale University in New Haven, Connecticut. Can you tell us a little bit more about the candidate school for nurses and midwives at Yale?
Oh, this is my baby. I would be happy to. Actually, I ran for the North Carolina House of Representatives in 2015. I was defeated in a primary, but I learned a tremendous amount. And I had a nurse anesthetist who was a friend of mine who ran my campaign, one of the most brilliant strategic minds that I know politically. And she also goes to Yale with me, and it was she and I that are doing the candidate school for nurses. So let me say this. We ran a good campaign. We lost, but there were a lot of factors going into that process. Number one, the medical monopoly sometimes do not want nurses to win office. They don't want us at the table sometimes. And I ran for a seat that normally cost about $8,000 to win. And medicine dumped $250,000 into a super PAC against my candidacy. And it's hard to beat that kind of money. But that being said, we decided, Kimberly and I decided to go back and get our doctorate at Yale. And we have a fabulous advisor there who used to work for the American Nurses Association in their governmental shop. And she is our advisor. And she said, you know, maybe we need to have a campaign school for nurses. So in our scholarly work, we found that in the 80s, there were only about 50 campaign schools in the country. Now there are over 500 campaign schools in this country. And we know that the whole trend with women getting elected to office has mirrored the number of campaign schools that have been opened in the country to help women. But back to Kimberly and myself, what we found when we went to campaign schools to kind of figure out how we wanted to set up one for us, we found out that there was a lot that we did not know. And we decided where we're going to open up the school for nurses. Physicians have been doing this since the 1970s. They've had a campaign school, have trained over 3,800 physicians to run for office. So nursing is woefully behind. You know, this campaign school at Yale, it's a 3.5-day intensive, and we're so glad that you applied, Patrice, and your resume was stellar. And of course, we accepted you to the school and look forward to working with you in the future, and look forward to you campaigning and winning, of course, one day. But we learned a tremendous amount, even in our scholarly work. But this is something that has been needed and will hopefully grow going forward.
And on behalf of the many nurses that are out there, I just wanted to extend my appreciation for you and the team with taking the steps to do that, because you have to be courageous because there will be pushback. But the same time that there's pushback, there's always a great appreciation that actually comes forth. So thank you. Now, I wanted to ask you, when it comes to, because we've talked about policy and politics and lobbying, but I would like to circle back a little bit and to define exactly what politics is and policy, because oftentimes those words, they can be very intimidating. So can you define it for those who are tuning in?
Policy is defining more or less a project, I guess you would say, a healthcare issue, and how to deal with those. Well, politics usually involves someone who is elected to represent, and they will be involved in manufacturing the policy.
So in summation, Sharon, what I hear you saying is that policies are the result of politics, which is really more so decision making, sitting down and coming up with the set of plans and activities to have an organization or entity run in the best way that it can.
Actually, I couldn't have said it better, and I didn't. You did a great job of pulling that together. And, unfortunately, sometimes whenever you've been doing this for a long time, as I have, you really hadn't had time to coalesce your thoughts about it. But there's one thing I would like to add. I'm the co-host of a podcast called Beyond the Mask, which whenever we chose the name of the podcast, we had no idea how fortuitous that name would be. But if you will take a look on that podcast, episode number 45, Kimberly and I are talking about why nurses would be excellent in politics, in policy-making roles. So take a listen to that. It is my podcast, but it's actually okay, pretty good. We're in the top 50 medical podcasts in the country right now. So go in there and take a listen to that. And you know what? You'll be calling me wanting to run for office yourself after that.
And I will definitely stay in tune to your podcast. One of the things that the benefits of the podcast, of course, is just to inspire people to bring about any type of change or encourage transformation in their lives. So at this point, we usually ask our guests to share some light on what they feel every NP student should know about their product or about their platform. But in this sense, you've been sharing so many tidbits. So is there like one takeaway that you would want our students to leave with today so they'll know exactly who they are as far as their position as nurse and how to leverage it?
Absolutely. In the words of a famous philosopher, Glinda the Good, from Wizard of Oz, you've always had the power, my dear. You just had to learn it for yourself. So remember that. You have the power, and it's time to leverage that power.
Well said. And how can students get in touch with you if they would like additional information about the candidate school for nurses and midwives at Yale?
It is still up on the website, the Yale School of Nursing. You can go there and find a link, and you can email us. If you want to get in touch with me, if you go to the Beyond the Mask podcast website, you can also get in touch with me through that website.
Well, I look forward to hearing more what you have to say as the next step with the candidate school. Thank you, Sharon, for taking the time out just to really encourage us about the power that we already have within. Thank you, students, for tuning into this episode of NP Student Mag, the definitive voice of nurse practitioner students. We'll see you next time.
Thank you.
Thanks for tuning in. Don't forget to subscribe, like, and share.